Welcome to Leadr Podcast, the ultimate destination for MedTech insights, leadership inspiration, and the latest innovation. I'm Steph Pliha, founder of Tribe Agency and your host for Leadr Podcast. Welcome to episode 15 of Leadr Podcast. Today we're joined by Spencer Jones. He's a nurse that's turned into a MedTech mogul and CEO at Lapivations and founder of XOMedTech. Tune in today. Spencer shares his journey from healthcare to innovation, the launch of his platform XOMedTech, and how he's empowering the next wave of MedTech entrepreneurs. Let's get into it. If you guys would have heard what we were just talking about, it's a whole other episode in and of itself. But today I am excited to invite Spencer Jones to episode 15 of Leadr Podcast. Spencer, welcome to the podcast.
Thank you, Steph. Excited to be here.
Excited. I know, I am too. We've talked about this and I'm glad that we finally made it happen, especially right before the holidays. So, okay, let's talk about, I always want to talk about how we know each other. And it always feels like a commercial for LinkedIn, but you know what? Maybe they'll give me a sponsorship deal at some point. So I actually went back before our podcast today and looked at how the origin story came about. I actually think I did a cold DM to you for your other company and said that I, love to talk to you. And then you had responded back, yes, I'd like to talk to you, but it's about your current company. And we ended up just exchanging, got on a phone call, and the rest is history. So Spencer is a super dynamic person. I can't wait to introduce him to the audience and you guys get to know him. He's got a lot to bring to the table. So if you're listening, tune in. The entire episode will be jam-packed full of information, especially you're in the MedTech industry. So let's talk about, first things first, your background. How did you come to current day and kind of what brings you to the MedTech world? Tell me about your leadership journey and everything in between.
Yeah. So did not think I was going to get into MedTech and didn't have like any itch for entrepreneurship necessarily. My dad did anesthesia. He was a CRNA. So it was kind of like a healthcare household. I always thought, he had a good life, gave us a good life. So that's what I want to do. And frankly, I started pre-med and I was just absolutely horrible at chemistry, which, I was like pledging a fraternity, 18, trying to take Chem 1 in a 300 person class. So like maybe that had something to do with it, but nevertheless switched to nursing, was like, let's just do CRNA, and kind of got out, into practice at the bedside after college, and like very, very quickly realized, kind of like developed this like tinker mentality, like problem solving, like, why is this way? This sucks. Why is it this way? Why can't it be better? And if you've ever spent any time in and around healthcare, it's just fundamentally broken in so many ways. One of the ways was, as a nurse, I felt like all the stuff I was having to use was just like really cheaply designed and not really made with the user or the patient in mind. So that's really where it started. Patented some device, had an idea, kind of patented some devices, filed the application, started talking to the people, business school instructor who I used to work at his clothing shop in Fayetteville. And he was like, yeah, do a business plan, talk to this guy. He said, do these 4 things, come back, did them. And really the next period was just like accelerator programs. I did 2 in like 1 year, which was a lot, but it was like a crash. The first one was really a crash course on like business, finance, IP, kind of the building blocks. And then the second one I did was medical device specific, 0 to 510 in Memphis. Shout out to 0 to 510, great program. But that one was like, as close to an MBA in MedTech as you could get. It was like boot camp style. I had to move there, told my hospital, I was like, hey, I've got this opportunity. Like, I can't not pursue this. Can I take a 3-month leave of absence? And they were like, sure. Yeah, we support you. Which is another tip to all you moonlighters out there. Be transparent with your business, with your employer, because there's a lot of reasons why, some legal and some just like it's good practice. But yeah, that's really how I got into MedTech. I'd say my leadership journey, like I was pretty fortunate to do, the accelerator programs, you do learn a lot about management and leadership. I managed people for the first time in my 20s. And that was, managing people in your 20s is tough because some of them are older than you. And then some of them are really close to you in age, which has its own thing. Yeah. So that was a bit of a big learning period. And also just like when you're like a doer, you want to do everything yourself and you can do it faster than they can, but that's not the point. The point is that you teach them over time.
Teach them to
Um,
fish. Yes.
exactly.
Yes.
So that was a big part of it. But then I credit to, we did I think it was a couple different like person, we did the Myers-Briggs, and then I did Soderquist leadership kind of retreat. And it was like a 2-day retreat, like full time. We were there for 2 days, dedicated. And it was actually Walmart. So Sam Walton founded Walmart. He would, put Walmart would put all of their, directors, vice presidents, kind of people climbing the ladder. They would put them through this leadership training thing. And it was like in Northwest Arkansas at this beautiful estate. And that was like really, I think, kind of grounding and informative for, what are my core values as a professional and as a leader. Literally write them out. There's 5 of them, right? And like how am I implementing this? How to be a better listener. There's one thing that stuck with me, which, I'm on a podcast right now, but it's about inquiring more than you're advocating, right? Like
Right.
if you can do that, the person that you're talking to leaves the conversation feeling more valued and more heard, and then you leave with more information. You gained a lot more information than you gave, right? Which is going to make you smarter and make you a better decision maker. So that Soderquist leadership training was huge. And then honestly, trial by fire, have made some mistakes managing, like all good managers have. But yeah, I think that was all of the questions. It was kind of how did I get to where I am, and then
Yeah. Yeah. Just kind of your leadership profile. So, a couple things. One, you're being very humble. Anyone that's listening, check out his LinkedIn page. He's actually done 10 patents, not just a few, like you mentioned. And then I don't know about the 0 to 510 program. So, I'm interested to hear more about that at some point when we talk later. But I'd be interested is that like 0 to 510K? Is that what that means?
yeah, that's kind of the tagline for it, right? But it was,
It's a good
there's a lot of
tagline.
a lot of incubators and accelerators, and like
Yeah.
what you find is like the med tech programming that you really need to drive value for med tech companies is like so specific. So like if you're in an accelerator and it's not med tech focused and you have a med tech product, like it's really tough for you to kind of maximize your value. 0 to 510 was laser focused on med tech, specifically products that require 510K clearance,
Right.
which just made the programming um amazing. It was also, I think there's a lot, especially with the remote accelerators and stuff, there's a lot of accelerators that are like, it's basically a glorified accountability group twice a
Yeah.
week on Zoom.
Yeah.
This was like 8 to 5, asses in seats, and we would work all night after that. And it was like literally, you know it really did scrunch a year of work down into 3 months, culminating in a demo day, and like absolutely life changing for me.
Another thing you mentioned that I just have to comment on because I didn't realize we had a few things in common, but um, the management in your 20s and managing people older than you. So, my first management job, I was, I think, 26, and I started at a startup, and I was one of the first 4 reps at this company. I ended up staying there for 12 years, but I was one of the first 4 reps at the company, and we all obviously were very tight. So I was the West representative. There was another guy, Jay, in the Southwest area. There was another guy, Joe, in the East, and then Lauren in the South. So we split the country. I'm actually impressed that my 50-year-old brain just recalled all their names. But
That was
anyway,
great.
that all being said, there was one not to be mentioned on that team. We were all buddies. Like we would go drink together, we'd have all of our national sales meetings. So I ended up becoming the leader of the West, and they consolidated, part of the country. And then another one of our peers became the East representative. And so it was my first job. And unfortunately, I was tasked with letting one of them go, who was a friend of mine, but also my senior. I think everyone was my senior when I was like 25, 26 years old as a leader. Anyway, totally life changing. Wouldn't recommend it,
Yeah.
but it obviously taught me that it's not personal, it's business. And ever since then, I've obviously let quite a few people go in my leadership career. But anyway, just had to touch on that, feel you on that. And yeah, I mean,
Yeah.
if you can get into management early, it's the best place to fall, right? If you're getting in your 30s and 40s, all eyes are on you at that point.
I think it is. I mean, I'm curious if you have any like tips or tricks for kind of that like managing up in terms of age.
Yeah.
Like anything that was helpful or useful for you. during that?
Well, I learned through the School of Hard Knocks, really. This was kind of predating my investment in myself. And I was immature, socially unaware, And so I think the biggest tip that I now, when I speak on this topic, and I get asked a lot how to break into medical sales from a lot of my friends' kids and my kids' friends as well. And I always tell them to invest in a book called Emotional Intelligence 2.0 by Travis Bradberry. If you are not emotionally intelligent, because no one comes out of the womb emotionally intelligent, you come out with IQ, which is your genetics. But the EQ piece is the missing piece. And it's heavily impacted on the younger generation that may not have that life experience. They may not have, the career experience combined with a lack of maturity is a disaster when you're trying to be taken seriously. And so I think early on, if I were to go back and manage myself back then, early on, it would be to invest in learning and understanding the facets of emotional intelligence. And then the other book that I think had a huge impact on my early management career was One Minute Manager. I still have it on my bookshelf here. It was the best way to talk about a praise or a reprimand. And really, have you read that book?
No, I haven't.
You have to read it. I mean, even though
Yeah.
I don't know if you're a people leader right now, but anyone listening, if you're early in your career and you're a young leader, two books, Emotional Intelligence and One Minute Manager by Ken Blanchard. Those two are game changers for all leadership, whether you're young or old. Anyway,
Yeah.
that was
I
my
need to
response.
I need to read that because I've uh the so talking about kind of those like management strategies. I forget, it was called like a 360 review. We did one of those, and then there was another one that we did that was, talked a lot about it was a very like interconnected team dynamic assessment. So it would literally tell you like, hey, when you are communicating with this person on your team, when they are in stress behavior, they're going to respond like this, and you should communicate to them, like X, right? And
Right.
then if they're in normal behavior, they're optimal, you can talk to them like Y. And this is what, so it was very like incentive, motivating factors, things to watch out, things to avoid. And that was really helpful, like obviously in real time for the team I was on.
Yeah.
But I think it really taught me some of the principles around, kind of the platinum rule of like, don't talk to people how you want to be talk to them how they want to be talked to
Right.
and what they need to hear.
Yes.
And I think too, the other thing is timing is really important. When you bring something up, obviously how you bring it up, but like when you bring something up,
Yep.
right? Like, do you wait until you're one-on-one or get out of the heat of the moment
Yep.
or, those types of things. So I totally agree. And the emotional intelligence part is really big. I think, to me, it's like you should do everything you can as a manager, especially in that kind of situation, when you're managing somebody more senior, and that can be more senior in tenure at the company or more senior in just like raw age.
Hmm.
But like I think you should do everything you can to make them feel comfortable, kind of meet them on their level, communicate how you want to be communicated to them. But I definitely think that early and often, if they are doing things that
Hmm.
they shouldn't be getting away with, you would never let anyone else talk to you like that, get away, all of that stuff. Like, you have to nip that in the bud early. Like, you
Yeah.
can't let that persist, um because it just creates a horrible dynamic.
I think early and often on both reprimands and praises. And I do also
Yeah.
subscribe to the idea of praise in public and reprimand in private. And I
Yeah.
did not know that in the early days. I mean, there were so many fumbles in my 20s, that I just would go back and laugh if I had to manage myself at that point. But you
Yeah.
live and learn, for anyone that's aspiring to be a leader or they're a leader in med tech and they haven't figured it all out yet, over time, you'll see the same people show up on your team over and over and over again. And you have the playbook from the last time you managed that person and you apply it to the next person. I'm like a
Hmm.
believer that there's like really only four types of people, you know?
Yeah.
So,
Yeah.
and they just keep recycling, different flesh, but really the same profile. And so, anyway,
Yeah. Can I
enough about
one
that.
more
Yeah.
sorry,
You
I know
go.
enough about that. One more
No.
quick thing. Um, the and this isn't like profound. I know a lot of people already do this, but like I think it was every month I would do this, but like a one-on-one, and then I would start it off by saying like, what can I do to be a better manager? And
Yeah.
like that would like really like defang any tension that they came into it with. And like, if they want to pop off about that, they can pop off and get it off their chest. But I think a lot of the times, like especially if you're thinking like they don't really have much here in terms of like what they're going in on, just let them keep talking, sit in silence, just like
Yeah.
let them vent.
Yeah.
And like a lot of the times they'll end up like coming on strong and kind of walking it back and realize, and then like there's some self-reflection there. So I think that's a big thing. Those were really helpful with me, those monthly one-on-ones.
Yeah. It's so funny. And then I do want to get into your company, but we're kind of on a roll on conversations that I love to talk about. Leadership is one of my passions in life. But my colleague Rhonda and I, we are in the future going to write a book of quotes because I'm a big quoter. Everyone that's been on my past teams has heard all of my quotes. And then Rhonda also is a big quoter. And I think there's a ton of wisdom that comes out of that. And one of the things I've always said is, whether you're winning or losing, you should always know why. And that puts people on their heels because if they come in and they're kicking butt and they're doubled their quota, but they don't know why, then it was luck, right?
Yeah.
And also, if they're not hitting their number, but they don't know why, that's worse than not hitting your number. If you're not
Yeah.
hitting your number, you should have it dissected down to the quota of why you didn't hit your number or what your plan is to recover. But
Yeah.
winning or losing, you should always know why. And
100%.
that's one of many quotes that I'm fond of. I'm also fond of do you lack the will or the skill? Because one is lacking, maybe both. If
Hmm.
you're not getting your at bats and you're not swinging home runs, you either lack the skill to hit the home run or you lack the will to swing the bat, right?
Yep.
I could go
Yep.
on a tangent about all the the quotes. Anyway, all right. So, Spencer, let's talk about XOMedTech because that's how I know we initially met through that
Yep.
conversation. And I do think you've got something there and I want to share it with our audience. I think it's very aligned with this audience for Leadr podcast. And
Yeah.
I know you and I are planning on working together on a project we'll talk about in a little bit. But tell me about XO. What are you hoping to accomplish there? What is the problem that you're solving for? How did that come about?
Yeah, no, thank you for asking.
Hmm.
I'm excited to talk about it. So XOMedTech kind of at its core is, an online network and training platform for medtech innovators. And I know people are probably thinking online network and training platform, what the hell is that? So I'll start with the problem that we're solving. So, you know, cutting my teeth, building a med tech company, frankly, in kind of a med tech desert. I'm in Northwest Arkansas. There's just like not a lot of med tech here. It is a booming area, Northwest Arkansas, Fayetteville, Bentonville. Like if you haven't ever been here, like absolutely come and see it for yourself. But it's retail, it's logistics, it's Walmart, JB Hunt, Tyson, all that stuff. But anyways, so coming up trying to do this, most innovators clinical innovators, right? They were dealing with the problem firsthand. So you're not, your pre-med, your pre-nursing classes you're not taking any business classes for the most part, right? And then you've got an idea and then you need to do something with it. I was fortunate enough that I could uproot my life and move to different locations to do accelerator programs and get this education. Most people do not have that luxury. And then, frankly, a lot of the content in terms of the programming and the training that we saw out there was just like not great. And there's some really smart people doing some really great things and making some good content. But what we saw was like it can be informative, but not actionable or not necessarily tactical sometimes. Like it's like good information, but like how do you actually apply this? And it's not a direct linear line on that piece. Another piece of it was, I was starting to consult on some different projects with through Merge Medical Device Studio. It's like a idea through DFM, design freeze, regulatory design and development shop, right? And one of my buddies was running it. And we just realized that like when we're working with these early stage innovators and these clients, like they're asking the same exact questions every time, and we give them the same answers. Obviously, a little bit different here, there, whatever, case by case, but like it was not a good way for them to retain and then weaponize that information because it was just regurgitated over a Zoom call. And it's like it was just not working, right? We weren't teaching them to fish. We were explaining them how to fish, but they didn't know they didn't really know how to fish after that, right? So that was a big piece of it. I think the other piece, talking about the desert element, like if you're in Boston, Southern California, South Florida, maybe Memphis. If you're in a med tech hub, you can find people that are doing what you're doing. You can buy them coffee that work at these large companies. But like, if you're not, it is really, really difficult to find vendors, service providers, mentors, KOLs, like anyone doing anything near you or in the space. And we thought that was a huge issue, going to a couple conferences a year, paying a couple $1,000s and hoping to bump into the right people. Like
Right.
that's not a scalable innovation strategy. So that the network element was part of what we tried to solve. So those are the problems we were trying to solve. Um, so XOMedTech, it's hosted on Circle, which is kind of like a community-based platform. Think
Hmm.
like Squarespace is for your website, Circle is for community-based platforms, and it's a really fun place. Frankly, it's almost kind of like a private Discord, except it's like a lot cleaner and like easy to navigate. But you can ask questions, get advice, post general discussions. Like the idea of like the kind of the main message board almost, or the main feed, is just a massive exchange of value. Hey, I found this. Hey, does anyone have a resource for this? Oh, yeah, like 3 people firing off introductions. So it's really just a massive exchange of value and resources and people helping each other grow. We have a ton of service providers, aspiring founders, ideation, pre seed, all the way seed, series A, innovators, engineers, biomedical, mechanical. Like it really is just kind of this like massive pool of all these people that are in and around medtech innovation. We eclipsed 100 members in the community last month, which was amazing.
That's
But I'd
phenomenal.
say,
Congrats on
yeah,
that.
no, it's super pumped. And then one of the last things I'll end on, and it's kind of the biggest point, and kind of where it started, was we were building out these lessons and ended up turning into this entire playbook, which is, think like an online course.
Hmm.
45 lessons. I think it's over 45 lessons now. A to Z on all things kind of you need to know medtech. Starts with like, hey, here's the chess pieces on the board. Are you solving a real problem? How are you quantifying that? What is your value proposition? Market research, IP, regulatory. Like it goes all the way through capital strategy and fundraising, non-dilutive, dilutive, valuing your company. So it's really kind of your 0 to 1, 0 to 2 guide. But we designed it to be kind of the like kind of opposite of what the current state of medtech programming is. Like it's not hour-long webinars, and no offense to hour-long webinars, they have their place, but like we wanted to make it bite-sized and asynchronous, and there's
Palatable.
infographics, yes,
Right.
palatable infographics, video walkthroughs, tons of downloadable tools and templates like spreadsheets or Word docs. We even have like AI prompts in there. So it's kind of like tons of things that really allow you to like weaponize what you're learning, and put it into action quickly. And you can get through most of the lessons are in like 10 to 20 minutes, max. Some of them are quicker than that. But the beta user feedback that we got when we rolled it out with like, the first 2 dozen people was like phenomenal. I mean, we had like on market, post series A, CEOs that were like, this was such a valuable lesson for like, playbook to go through for me. They learned a lot. The people that are just getting started are learning a lot. It's really fantastic. Anyways, I'll shut up about it, but and we're bootstrapped. We're a small team, and it's been just like this super fun, organic experience kind of building and growing this thing thus far.
Yeah, I just think I wrote a tagline for you while you were speaking. So, if I'm the ideal client profile, which you and I have the same profile, I mean, meaning we appeal to the same audience. I work
Mhm.
with Tribe, I work with medtech startups from angel investors or even just seed all the way up to series A, B, and then typically they have their own marketing and branding team at that point. But I also work in that same lane. And I have a couple of clients right now. I think I mentioned when we first spoke where they
Mhm.
are in kind of an island on their own and would love to have the network. And so my thought is like, it's the network you didn't have. So
Yeah.
if you are in these big biotech and medtech hubs where you can go into an office building, throw a rock, and you can find 4 other innovators in the same building, but then there are areas where one of these clients I'm thinking of specifically, she's in Nevada and it's a little bit more remote. And so you're essentially able to tap into a network that you didn't have on your own and you didn't have within proximity.
Yeah.
And I've actually taken a deep dive into Spencer's XOMedTech. It is exhaustive. I mean, it's big. It's a lot of information. It's an inch thick and a mile deep, um,
Mm.
or inch,
Inch wide, mile
mile.
deep.
You know what I was trying to say. It's the
Yeah.
opposite. It's basically a layer surface of everything you need to know. And then you work with people like myself and service providers when they need to go deep in any one topic. But it kind of gives you, is that a fair assessment?
Yeah, I just and briefly, it's like people ask a lot. They're like, "Well, there's all kinds of like it depends, right?
Hmm.
Like, what's the rule here? What's the rule there? Or like, are you doing consulting? We're not selling consulting hours. Like, this is not a consulting play." Um, but like the way I describe it to those people is like, we are teaching these people the geometry and algebra, and then the strategy for how you would do calculus. We're not teaching them calculus, trigonometry,
You're
like
not
that's
doing one on
all.
one hours and coaching with them.
Yeah.
Right.
And we're not like, people are like, well, my device is like super unique and special. Like, is it really gonna speak to me? And it's like it's innovation, right? Like everybody's device has their own niche, but like so much of the principles and the lessons and stuff, like it's kind of like we try to do a lot of like, hey, here's a case study and here's the inside baseball. Like you said, why we're winning, why we're losing.
Hmm.
Here's a case study, here's why we won, here's what we got wrong, here's how we could have done it better. So it's really like it's we try to make it to where it feels like you're binging Netflix, but it is I always put, talking about an inch deep, mile deep, whatever, I
Yeah.
say it is a dangerous level of information about each topic, right? So that
Yeah.
you are going to go into that meeting with an IP attorney or a regulatory consultant or whoever, and
And be
you're not
prepped.
be prepped. You're not
Yeah.
going to pay them to educate you. You're going to pay
Right.
them to put into action. There's a saying in healthcare, working at the top of your license, right? You're going to be going to that attorney or that consultant or whatever, and you're going to have them working at the top of their license and delivering the
Hmm.
maximum value
Right.
for whatever hourly rate you're paying
Hmm.
them.
Yeah, I think even, I'm thinking about this particular client in Nevada, even if she had access to your information prior to working with Tribe, and then she would kind of know what she needs right now versus what she doesn't need right now, and be able to weigh out where she's going to put her investment money, and what would be really relevant early days versus what can wait for another year or closer towards commercialization. So I think the way you have it set up is really comprehensive, and you don't skip a
Yeah.
beat. Plus,
I
go ahead.
I was just gonna say you kind of hit on like a almost like a pseudo tagline we have. Like we don't use a ton, but it's like all throughout the playbook. Um, you know, the playbook is designed to teach you what you need,
Hmm.
who you need to do it, and when you need to do like when you need to do it, right? So
Right.
it's kind of like the who, what, when. Because a lot of times, like you'll talk to a regulatory consult, like you'll talk to one person and they'll give you like 8 pieces of the puzzle,
Right.
and it's like, yeah, these are, it may be some of the pieces are to the wrong puzzle, but it's like very focused on like their thing.
Of course. Yeah, their
But so if you get that
specialty.
broad, yes, of course. And so if you get that broad picture, then like, hey, okay, yes, they're moving this piece, but like here's how it affects the other pieces versus just having like blinders on until you talk to the next person that shoves you 10 different similar
Yeah.
pieces of the puzzle.
Yeah, no, that makes perfect sense. It's like the 35,000-foot view of being a med tech innovator, from soup to nuts, A to Z,
Yeah.
however you want to describe it. Everything you'll need to know or you will encounter through your journey at a high level, and some, more context when necessary. And then the reason why Spencer and I started working together and collaborating is because he's also working with subject matter experts, like you'd mentioned, in specific lanes. So obviously, we do brand, go to market, consulting. We do a lot of what he says he doesn't do. And so he's got this massive network built in XOMedTech as well. So when you join, which I think it's a membership, correct?
Yeah, it's an annual membership
It's an
model.
annual membership. So once you're a member of XOMedTech, you'll also get access to, the Yelp of the medtech industry. And
Mhm.
instead of having to go find them on your own, you'll have proven track record resources that are in this lane for all the various things. If it's not solved for within their own platform, then we have options for you to seek them out with, proven vendors within that service lane. Anyway.
Yeah. And real quick, like I was onboarding, we sell to like B2C, like your,
Hmm.
standard one-off people, but we also have like a number of like enterprise clients. So accelerator programs, incubators, universities, med schools. We've like those all like Vanderbilt, they worked it into their biomedical engineering accelerator curriculum. But I was onboarding, we sold, to the University of Arkansas, their new venture development course, which is like, kind of a team of undergrads and grad students that are, trying to really launch a business, do business plan competitions. I was onboarding them into XO, and she said one of the girls that was like getting on board was like, yeah, like I is there anybody in here I can talk to about regulatory? We've got this kind
Hmm.
of hard on a chip thing and blah blah
Hmm.
blah. And I literally went through the member list and I was like, yeah, Art, he's the president at Tamnet. Christine and Don, they're founders at MRC Global. They do regulatory consulting. Kyle at Rook, he's the CEO at Rook Quality Systems. They do quality and regulatory.
Hmm.
And they were just like, oh man, wow. And I was like, yeah, and you can DM them. That's the whole idea, right? So it's
Yeah.
just like the ability to like, at your fingertips, access those people. Also in kind of a higher trust environment than just like your cold DM, right?
Yeah. Or just finding people on LinkedIn on your own volition with really out without a reference check, right? So
Yeah.
you're building a network of medical innovators. So people that are looking to either bring their product to commercialization or they're in the middle of it, or maybe they even post commercialization and taking like a hindsight view of their business. Maybe there was some skip steps. I think the number one skip step, I say it in almost every podcast, but I'll say it again. The number one skip step of all innovators is market research.
Hmm.
Do your market research. It's painful. You can hire someone like Tribe or others to do it for you, but it is fruitful in the end. So, really,
Hmm.
what it does is it helps you identify what's the voice of customer, what is the real need to be solved here, and how do they want that solution to show up in the market. And by doing that and validating it, you'll spend a lot of less time wasted and going on the right path with the right solution. So,
Yeah,
um,
music to my ears. I could talk about customer discovery and the value of it all day. Like
yeah,
it's couldn't be more important.
it's funny because a lot of us innovators and entrepreneurs are ADDers as well, and so you always go towards the shiny penny. And market research is not a shiny penny. However, we can make it super easy for you. And I'm sure there's people within your world as well that we've kind of got this thing on lock, and as long as you can set up your questions correctly, make them palatable for those that you're going to send the research to, get your KOL list together. It's pretty straightforward, but so effective in vetting out your voice of customer and really vetting out what your solution and your value prop is going to be.
Yeah, and can I say like one thing? And we're actually I put together a video on this just because it makes for like a really good video. But like we're gonna one of the templates we used and then the prompt like are in XO. But customer discovery, like doing those interviews, they typically tell you to like tag team them because one person needs to be driving the interview and the other
Mhm.
person needs to be taking notes. So I put together this like big prompt, and then kind of a tool workflow where we've got like a customer discovery spreadsheet template, and we actually have the Google Sheet available as well. You can
Mhm.
download either. But then you use like a note taker, like we use Shadow, right? So I'm using Shadow Note Taker, do the interview, it gets a transcript. You plug the transcript into Claude, large language model, with our specific, the transcript plus our specific prompt,
Mhm.
and it will spit you out like a table format, copy paste with all the questions, all the answers from the person, flagging high intensity phrases where for those questions, hey, they had a high intensity response. We do a keyword and phrase analysis, so you see the things that they talked about or mentioned the most frequently. But it like does all of that analysis for you, so you can have a one person interview, get better notes than you ever would using this like prompt and workflow and tool. And then like some extra goodies that would just take a lot of time to do. So anyways, that's just like, I love customer discovery so much. I was like, how can we make this easier and like make people fall in love with it more?
Yeah. So another little fun fact that Spencer and I are working on because of the world we live in is we're coordinating pitch events. Because we both work with early startups in the med tech industry, we really just focus on our niche, which is med tech. I do have a couple of random clients in fintech and a couple in physicians' offices and things like that. But that's more just like a dotted line. But my primary bread and butter profile is medtech startups. And I know Spencer's is as well. So, what we wanted to offer to our networks is a live pitch event. We know there's a lot of pitch events out there, and there's never a short number of people that want to pitch, but it's often hard to get, the right people in the seats for these events, those being investors or VCs or private equity, or those that would be listening and giving you funding. So we decided we're going to host probably in the next week or so. We'll put the formal date and registration in the show notes around mid December for like an 8-minute pitch. And we've got a couple people in mind that we would like to give the opportunity to, but we're going to do it live on LinkedIn. I have yet to see anyone do a live LinkedIn pitch. So we might be the first. I don't know. But we are going to do that. And we wanted to start helping. One of the things that Tribe does, we work with our customers very closely on their pitch. We took a lot of principles from Shark Tank of all things, because people go on there, they have a limited amount of time, and those individuals have a limited amount of attention. And so you really have to look at what they care about. And I think where in people in the med tech space, they're so intimately involved in their product that they really just want to give it all the time and really go into this kind of almost feature benefit dump. And in an investor pitch, that's not what they're there for. None of these people, most of the time, are medically oriented. They don't have that background or experience. They really don't need to get into the weeds of the product. What they want to know is, why should they invest now versus wait? And what is the
Mhm.
problem? And quantify the problem. Is the problem big enough to solve? And
Yep.
are they going to get their money back? That's really what they care about. So we have kind of a 15 slides talk about lead magnets. We actually have a downloadable that's free that we give our 15 slides. We don't give all the information, but we tell you what should be in order of the 15 slides that should be in your investor deck. All that being said, though, I have a passion around that. We build decks for people. We have gotten our clients quite a bit of funding through our process. And I know you have done the same with your platform. And so the two of us will be moderators on this pitch event. We're also inviting other people that have a ton of experience in this space, maybe even a couple of investors that can give live feedback. But we want to just make you aware that's kind of coming together. We're flying the plane as we're building it. So
Yes.
be on the lookout. We'll be sending out invites via LinkedIn, but that should be up and running in the next couple of weeks.
Yes, I'm super pumped for that. I'll say, if you're listening to this and you're thinking like, I can't share my special secrets and pitch my company live, like, if you can't communicate your thing non-confidentially enough in 8 minutes, or if you think someone's going to beat you to the punch with your own thing that you're developing, like, this isn't for you. So like, I would say, throw that concern aside. Like, this, you don't have to like dive into your special secret
Your
sauce, trade
IP.
secrets. Yeah,
Yeah.
exactly. Like, that's not what this is for. This is for reps, right?
Yeah.
Live reps. Like, you get on there, the light turns on, you can feel your heartbeat thumping in your neck. There is no substitute for that. So getting your reps in, that's what this is about, getting good feedback from people that know and have done this before. So like, if this can be a great opportunity, hopefully we see a bunch of people step up to the plate, because there's just no substitute for doing it live.
Absolutely. Yeah. And I also think beyond getting the reps, you're getting a huge amount of exposure for your brand.
Oh yeah.
Even if you're pre commercialization, pre FDA, 510K cleared, you can speak about problem awareness, but you can also speak about, problems that you're hoping to solve with your future innovation. So be on the lookout for that. So, Spencer, we're coming to the end of our time, and it's been so
Mhm.
delightful. I do want to ask you the final three questions that I ask every guest, and those are kind of a speed round. I talk about who is a mentor that you'd like to shout out and pay it forward. I know everyone has many, but pick one. What's a superpower that you feel like you have and why? And then also a book that's made an impact on you as a business person. It doesn't have to be fiction or nonfiction. There's no rules, just a book that maybe other people would want to pick up because it made an impact. Those are the three things.
Okay. Okay. Let me think. So there's a couple mentors that I have in mind. Um, I'm gonna kind of split this, just because I'll say Jeff Amrine, who is, he runs Startup Junkie, which is like an entrepreneurial support organization. He's got, I kind of met him through Innovate Arkansas, which is a group that he was involved with, but like he is doing so many amazing things in Northwest Arkansas with entrepreneurial ecosystem development. But like, I remember him as one of the first people that really kind of looked at me and said like, hey, like you may have something here, like keep pushing, here's what you need to do. And he was just instrumental in giving me that like roadmap to get started, as well as the confidence to keep moving forward initially. So
Mhm.
big shout out to him and everything the Startup Junkie team is doing. And then Jared Greer, so he's a CEO that I worked for, or he is just one of those, and I'm going to say this completely endearingly, but like freaks of nature, up at 4 to 4:30, works out every morning, has, like so much going on, great dad, to his kids, multiple kids, and like just like a smart, like professionally responsible, financial, like just like he's one of those people where it's like, you know what, like anytime I'm feeling lazy or whatever, or I'm like, oh, I have to get up at 5:30. I'm like, he's probably done with his workout by now. You know what I
Yeah.
mean? But that was just working for someone like that was just like really, really great because it kind of like pushed me to be better. And a lot of the lessons like I learned from him were just like not verbal. It was just like watching his experience, like watching him operate.
Yeah.
So that's one. Sorry, I'll be quicker. I know this is a
No,
lightning
you're
round.
fine. I love it. Mentors are amazing and they've made a huge impact on all of our lives. And I think that you got to give them the time. So that's fine.
Yeah. So the second one was, I would say like maybe bias to action. I wanted to maybe throw that out there because I think it's such a strong thing for entrepreneurs to have. I don't know that that's like necessarily like superpower, but like maybe like the expanded, like I think I work really quickly, and uh like my ability to like, hey, there's a set of facts, a problem that needs to get solved, whatever. My ability to kind of just like go into a solution and figure out or quickly deviate and kind of develop another solution, decide if I need to present two options. You sort of like, because the ability to like do that, and like have the technical skills to do it right. Like, do I need to make a video about this? Do I need to edit that video? Do I need to leverage an AI tool? Do I need to build a model for this in Excel? Do I need to like, so I think that kind of like, I would say pace of play almost, because if your pace of play is high in entrepreneurship, you're going to either fail or win faster. And the more you do that, the more likely you are to like every coin flip's going to be more likely to win, right? More likely to be a success. So I'd say that, yeah, I'd say productivity. Like, I know it sounds lame, but like just that like pace of play. I think it's been I think helpful for me. The I would say books that I've read, like honestly, uh, there was I don't think it's a Malcolm Gladwell book. Oh, what was it?
Love Malcolm.
It was like a psychology, and I'm like such a visual person. Like I can see the cover of the book. It's
It's
like
not
there's like a big,
multipliers, right?
no, it's like there's like an elephant on it, but it was about psychology. I can't believe I'm not remembering the name, but like it was a lot about choice
Hmm.
architecture and design around choices, and um also communication and things like the power of the default, right?
Hmm.
Like the default setting on something, 60% of people are never going to change it, right? One of the other lessons was they like fundamentally and statistically significantly change the overall health score of all of the children's food at a cafeteria, right? By moving where the items were placed as they went through the cafeteria line,
Yeah.
right? Same items. One was closer, one was stacked, one was a little bit farther back, whatever. And they
Right.
just fundamentally ate healthier food based on how it was presented to them and the choice architecture. And that like stuck with me because like whether you're selling someone on something or like, it's a sales call, it's like, what choices are you giving them, right?
Yeah.
How are you designing that? Like even like the questions you're asking, like are you asking them like, are you ready to buy today, or are you saying like, is this relevant to you,
Yeah.
right? Like the choices you're giving them to say yes or no. So anyways, that like I love those like psychology books, obviously the Malcolm Gladwell ones. I feel like that's kind of a played out thing to say, but all of those. But then it was Tipping Point. I think it was
Tipping
called Tipping
Point.
Point.
Yeah. That's a good book.
um yeah, I think that was That's probably what it was. That was yeah, that's not a Malcolm Gladwell book, I don't think, is it?
Tipping Point's a great book. I don't know. We can look it up. We'll
Yeah,
look it up.
we'll look it up later.
We'll link it, whatever the book was on choice architecture, we'll link it in the show notes. So Spencer, thank you truly for being on. I feel like there's a lot to come with us. We've got our pitch event coming up. I'm
Oh, yeah.
excited to promote that. And I also am really excited about XOMedTech. I think it's going to do phenomenal things. I think
Yep.
everyone listening today, you're probably going to get a few phone calls. So I'll put his
Yeah.
LinkedIn and my LinkedIn in the show notes as well. Thank you again. Really appreciate
Yeah.
your time today.
Steph, this was so fun, honestly. I love doing pods like this where we get to kind of just like cut loose a little bit and just like, think out loud. So I really appreciate you having me on. Really excited for us collaborating, pitch event and other things. But thank you to everybody that tuned in. Like if you want to get in touch with me, LinkedIn's gonna be in the show notes. Definitely check out XOMedTech. We'll link that in the show notes. But yeah, thanks for having me on, Steph, and everybody listening. Thanks for tuning in.
Yeah. If they're still here, really, thank you.
Yeah.